Why do we need a trauma-informed approach to dementia care? COVID-19 has had a profound effect on older adults, families, and staff in long-term care. The federal and state-mandated lockdowns, quarantines, and social distancing caused physical and social isolation for everyone. We have all experienced loneliness, helplessness, and boredom. Our daily routines have been disrupted. We experienced social isolation, including physical and emotional separation from family and loved ones, which makes life very difficult. Nursing home staff, families, and residents experience these traumas both in their personal lives and collectively. But the pandemic has been especially devastating for people who are living with dementia. Many people with dementia do not understand the public health emergency. They do not understand why at times they have not been able to see their family and loved ones. Many have felt abandoned and afraid. Masks and personal protective equipment, or PPE, can be very scary for people with dementia. It makes it difficult to recognize people who are wearing masks and makes communication very challenging. Their daily routines and group activities are often disrupted and sometimes lost. Many were isolated in their rooms without anything to do and are often unable to initiate activities to keep themselves occupied and connected, or participate in self-care activities. Many people with dementia have been anxious, irritated, and depressed. Some have been aggressive toward people they do not know or recognize, especially with so many agency staff who to them are strangers dressed in PPE. Long-term care staff, families, and loved ones around the world have collectively felt this trauma, as well as the guilt that they were not able to do enough to make things better for the health and well-being of people living with dementia. We are in a time of consistent and drawn-out collective trauma in which healthcare providers are experiencing their own extended personal traumas while simultaneously experiencing collective pandemic stress in their workplace. As we find ourselves still coping with the pandemic, the principles of trauma-informed care can be used to develop plans to care for ourselves and others, and provide tools to advocate for self-care as we navigate our professional and personal roles. Trauma-informed approaches can support workers to promote resilience that can then support empathy, compassion, patience, and creative problem solving in their care interactions with residents. Trauma-informed approaches are relational and person-centered. Use of these approaches empowers organizations, supervisors, and staff to work together to find alternatives to quick fixes. In turn, this ensures that we don't lose ground on the progress that has been made over the last 10 years in reducing the inappropriate use of antipsychotic and psychotropic medications. How can your team focus on the pandemic experience of people living with dementia and emphasize person-centered care, better communication strategies, and stronger relationships in your community?